invention of the African continent, iconic words made by Dr. Kwame Nkrumah, and we're celebrating him this month of September ahead of his birthday on the 21st. And so that was our Nkrumah quote for today. A few of your messages have come in. Good morning, GTV Breakfast. You guys rock. I am Richard from Lakeside Estate at Shalibutre. Thanks for a lovely show. Get some shivers, and I tend to get some stiffness in my fingers or in my hand and other parts of the body. So your knee or other joint, you may be feeling some shivering sensations there. It may be due to arthritis, and it's one of the painful joint diseases that cause stiffness, and we are told it can worsen with age. The spine doctor is here, Dr. Brian Cox, CEO of Spinal Clinic Limited, and he's here to give us some answers to some of your burning questions. And he came with his spine skeleton, and first question I asked him, what has arthritis got to do with the spine? The spine is back there. Arthritis, usually it's in fingers or your hands. Back there.
It can be anywhere in your body.
Arthritis can be anywhere.
Yeah, it can be anywhere, but mostly joints. And see, the thing is that we all have joints. We know about the knee joint. We know about the ankle joint. We know about the elbows and the shoulders and so forth, so on. But we don't think about the spine as being a joint. You know, we have 24 joints in our vertebrae because they have disc. Okay, discs are like cartilages, and that's, you know, a lot of times people don't realize it's more like an osteoarthritis. When you have osteophytes or when you have spondylosis, that's an osteoarthritis.
What's osteoarthritis?
Osteoarthritis is degeneration.
Okay.
Degeneration in the spine. As we get older, let's say you have wear and tear in your knees. Your knees sometimes it has joints in there, and when that disc wears down, it could be the knee, it could be the back, it could be your fingers. But when the disc wears down, it actually rubs. The knee joint starts to rub together, and as it rubs together, that's a form of osteoarthritis. And you know, there's over 100 different arthritises. Did you know that?
I did not.
There's over 100 different arthritises out there, but it's 5 that most people concern themselves with it. The most common is osteoarthritis. Then there's rheumatoid arthritis. Then there's psoriasis, and that's more of a dermatologist type of thing. That's more dealing with the skin. Then there's fibrom.
There's an arthritis for the skin.
There's a person who has psoriasis. It's like an autoimmune disease. Just like with rheumatoid arthritis, is more of an autoimmune.
So is it like what we're seeing on the screen now? So
I don't know.
It looks like, aging
that
skin.
Could be more like rheumatoid arthritis, where the fingers are kind of. My dad had rheumatoid arthritis, so he always complained about his fingers and things like that. But you know, fortunately, my fingers look pretty good.
I think so. I agree.
So, but he had rheumatoid. It wasn't as bad as that picture that you saw there, but psoriasis. Then there's fibromyalgia. A lot of times, in fact, most of the people who get fibromyalgia are females, and a lot of times they go to the doctor, and it's like they're just having pains, and they don't know what the pains are. And you know, sometimes the doctor will even say, you know, you're thinking too much, or it's in your mind. But it's an actual disease, fibromyalgia. But basically, it's pain in the muscles, and they don't know what really the cause of it is. But you know, I've had patients that's come to our office who have had fibromyalgia, and as they start getting adjusted, they notice drastic changes in their body. And then the last one is gout. And I'm pretty sure you've heard of gout.
Gout is a form of arthritis.
That's a form of arthritis
I'm learning so much new stuff today.
Yeah, that's a form of arthritis as well. And that's generally at the big toe area. You have too much uric acid in your body. So that gout, you know, it affects those joints. So we have to reduce the amount of proteins, meats, and things like that we're putting into our bodies, because that's a major beer. That's also a major part of when people get in the gout syndrome and so forth, so on. So there's really 5 major arthritis is out there.
But what are we doing to bring this onto ourselves for those who have or who are in that painful condition? What did they do to contribute to that state?
Well, some of it could just be age related. You know, as we get older, naturally our bones will start to degenerate. And as our bones start to degenerate, it can cause certain type of issues. Like, for instance, I'm going to use the spine as an example, since that's what I generally work with, is the spine. But let's say these vertebrae here, let's say the disc in between those vertebrae, they tend to reduce in size as we get older. It could be some type of trauma. You know, let's say you're a runner and you used to run all the time, and you put lots of pressure on the disc in the knees, or I should say the cartilages in the knee. And when it happens over time, the cartilage in between there starts to go in, you know, get smaller and get smaller. And as it gets smaller, it rubs up against the knee.
Bones.
Sometimes it may be spurs. You know, it could be spurs in the knee. It could be spurs in the spinal cord, or the spine, I should say. It could be spurs in the neck. It could be spurs in the wrist, in the ankle. All these different things can cause pain, cause degeneration, or cause you to feel uncomfortable, and then you start to have pain. Okay, start to have pain. So some of the things you can do is, believe it or not, exercise will help you. You know, some of us, we put it on ourselves because we don't exercise. We don't eat the right types of foods. It goes back to the 4 pillars of health. You know, not eating the right types of foods, not exercising, not keeping a positive mental attitude, and not getting a proper amount of rest. All these things, of course, along with the chiropractic care, if you don't take care of your body, getting your joints mobilized in certain ways, it's going to cause problems. I have an old friend of mine, a patient of mine was telling me about an old friend of mine. And, you know, this gentleman, he does judo and karate and, you know, kung fu, all the boxing and all these different types of things. In great shape, you know, from the outside. You see him as a person in great shape. But because of all the traumas that he put on his body, he now has osteoarthritis throughout his whole body. And you can call them all types of, you can call it all types of diseases. You can put it out there. But the bottom line is that it's a misalignment in the spine. You're
telling us to exercise in one breath, and you're telling us exercise sometimes causes the so
you can.
Where's the middle ground?
Excess of anything can cause a problem. Like, for instance, if you notice, most footballers, you know, especially if they were professional athletes or almost at that professional level, as they get older, they have a lot of joint issues. And the reason being is because they put so much pressure on their bodies. Like, for instance, myself, I played American football. I ran track. I did do a little bit of wrestling. But the main things I did was American football and track. In great shape. I remember one time my dad used to tell me, I used to do this, I used to do that. And I was like, okay, yeah, whatever, Dad.
Now you're there.
Now I'm not quite as far as he was, but I am there. I'm getting there. I feel the joints. I can't do nothing like I used to be able to do it. And I'm like, golly, my dad was telling me this when I was young.
Sounded
and now
so
I'm
far
sounding
away.
like my dad. Because I'm now having all these joint issues, and it's painful, you know. And I, for my patients who are looking at this, I feel your pain. I understand. You know, in fact, when I broke my leg, I was going to say something about that the last time I was here, but when I broke my tibia, the pain I was going through at that particular time, and, you know, I still have joint aches from that pain back then, but the pain I was going through, it made me understand the way my patients feel as well.
So you can better empathize.
I can better empathize with how some of them feel.
Is arthritis one of those conditions where people usually miss the signs and symptoms until it becomes much more pronounced?
Yes. A lot of times people miss the symptoms until it's later. and I will use my patients, for instance. I have patients that are as young as 4. I have patients that are 4 years old, infants, really. But there's 25-year-olds. You wouldn't think a person who's 25 years of age are having spinal issues.
Because you've mentioned age-related, and there's a message here from one of our viewers, and he's saying, my 72-year-old mother is always complaining about pain in the knees. What can we do about that? So we'll get to what we can do to manage arthritis pains.
Right.
But you're saying that 25-year-olds are getting it as well?
Yeah. We have people younger than that are having arthritis of some sort. Now, there are different types, of course. I said there's different types of arthritis, but yes, people as young as 25 can have arthritis.
And what are the signs we all miss until it's too serious?
Some arthritises are immune-related, autoimmune-related, where others are more because of traumas and things like that in your body. So for those autoimmune ones, you may be better off taking some type of medication. Same with the other one, but it's a different type of medication. It's more of like non-steroidal type of medication. And I don't recommend taking that all the time because that can affect your kidneys, livers, and all those other types of things.
And there's a way to determine whether a person's arthritis is autoimmune related or trauma related. Yes,
it's more of a flaming type of, when it's rheumatoid arthritis, it's more of a flaming type of arthritis, where the osteoarthritis is more of the joint related, like the disc has reduced in size, or you're having spurs and things like that. And you can ice and heat. Those are the things you can put on for arthritis, osteoarthritis. Get joint mobility by stretching the body, because a lot of us, we don't stretch. For all the different types of arthritis, we must change our eating styles. We must eat more fruits and vegetables. Now, sometimes I tell people if they take in lots of tomato, especially if they have rheumatoid arthritis and things like that, but if they take in lots of tomatoes or garden eggs and things like that, I would tell them to stop. Most of the time it's women. I'll ask them to reduce the amount of tomatoes and garden eggs and things like that in their diet. And for some people, they notice that it reduces the pains. Because of the acidic factors. And I don't know all the science behind the reasons why, but I just noticed that when they
works for some people.
Yeah, it works for a lot of people.
And
unfortunately, here in Ghana, that's our main diet.
Exactly. I was about to make the point that almost every Ghanaian meal goes with tomatoes of some sort. So jollof, there's tomato in there. Even if you're just grinding regular peppers to have at home, it's still peppers, onions, and tomatoes. So how do you eliminate that from your diet entirely? I'm sure the dietitians would be better placed to partner you in situations like this for a remedy. But who is most at risk if you're saying then that even younger people get some form of arthritis? So it's not just related to age. So older people.
Between people really start getting the arthritis between 30 to 50, between that range, depending on the things they're doing, how they're keeping themselves in shape. If you're overweight, that can cause more pains in your body. So exercising to help manage the weight will help alleviate some of the arthritis that you're having as well. Unfortunately, people wait until they get to a certain level. They at 1 second they're very small and thin, and then it seems like it's overnight that they've gained 20, 30, 40 pounds, and they're looking at themselves and it's like, wait a minute,
who's that in the mirror?
Yeah, who is that in the mirror? But they don't realize all the things that they've been doing over time. The fufus and the bankus and all the oohs, So we have to reduce some
Notice
of
that
these
kenke
things.
doesn't have an oo. So we are good to go. We are on a roll here. So diet plays an important role.
Yes.
But when all that fails and then the condition sets in, like our contributor said, 72-year-old mother always complaining about joint in the knees. My own grandmother is always persistently asking for painkillers. What can we do beyond taking painkillers to minimize the pain?
Nutrition. Start making lifestyle changes. I can't speak on this enough. Exercise. Get more joint mobility, movements in your body. Stretch your body, stretch your joints. I understand sometimes it's difficult to do these things, but when you're stretching and getting more mobility, it may feel bad at the onset when you first started, but over time it starts to reduce because you're now getting motion, movements in those joints. That could be the knee, it could be the ankle, it could be the wrist, it could be like you were mentioning to me earlier, a friend of yours or your mother, a family member would get a ball and they would just move their fingers. So what they're doing is getting joint motion in their body. If let's say you have stiffness in your neck, you can get joint movement in your neck by moving the neck, slightly moving it. And if you're in pain, you can do it slightly. You don't have to be really aggressive. Moving your legs around, walking is a very good exercise. If you know how to swim, if you have so much joint issues, then go out and swim. If you don't know how to swim, walk in the water because of buoyancy.
My favorite thing to do at the pool, just walk in the water.
Yes, just walk in the water.
Just walk in
or run in the water, because when you're running in the water, because of the water, it's not going to cause as much pains in the knee region.
And how
Yeah, what GTV Breakfast, that was a throwback to a conversation that Thelma had with Dr. Brian Cox of the Spinal Clinic on arthritis. This is your favorite way to wake up. We have conversations on runaway professionals who are leaving Ghana to go and seek brighter fortunes elsewhere. We have a conversation on community theater, and we've got the headlines coming up. And today is International Albinism Awareness Day. I'll be having a chat with Mr. Newton Katseku, who is the Executive Director of the Ghana Association of Persons with Albinism, in about 21 minutes. Ahead of that, Tamale's finest is right here. Her name is Maltiti Saida Sadiq. She's a sports nut, and she's got all the sports news for you right here on hashtag GTV Breakfast. She's smiling, and it's for her daddy who is watching in Tamale. Take it over, Maltiti, with the sports.